Joseph Jules Desjardins was born in Switzerland near Geneva in 1849. In 1871, he began studying medicine in Paris, and in 1879 he completed his doctoral thesis. He was one of the founding fathers of the French Neurological Society and was one of the leading pioneers in the study of localization of functions within the brain. Desjardins lived most of his life in Paris, working as a neurologist and a psychiatrist. His work focused mainly on ascending sensory tracts, and he would only ever accept claims supported by morphology. While not the focus of his entire career, some of Desjardins' most influential work was related to the study of reading. In 1891, he described alexia without agraphia. This is the inability of a patient to read or write. Further examination of these patients revealed there was a lesion to the angular and supramarginal gyrus. These structures connect the visual and auditory regions of the brain. This had implications for reading because it meant that the visual stimulus could not be converted into auditory information in the brain, a process that was clearly necessary for reading. This gave credence to models of reading that emphasized any sort of translation from orthographic or visual information to phonological or auditory information. The highly complex models of reading used today still incorporate such relationships. He also discovered a businessman who was his patient who suffered from right-side blindness. This patient could speak and write but not read. This patient had damage to the left parietal cerebral artery, meaning no visual information was able to be interpreted in the left hemisphere. The corpus callosum and splenium were also destroyed, preventing visual information from the other hemisphere from being transmitted to the right hemisphere. This is important because it localized the majority of the reading process to the left hemisphere of the brain. In 1892, Desjardins documented the first reported case of pure alexia, which is the inability to read without the inability to write. Such patients could not process words in whole units. They had to use letter-by-letter strategies for reading. Damage to the area shown here resulted in the symptoms of pure alexia. Due to the various types of impairments in reading resulting from so many different types of damage, Desjardins could not help but believe there were separate neural roots for different aspects of reading. Joseph Desjardins even began one of the most famous debates of neuropsychology that still exists today. Is there a specific word form processing area in the brain? The legacy of Desjardins' work still remains today. Information gleaned from aphakic patients with various difficulties in reading, including those described by Desjardins, have been instrumental in developing current models of reading. His descriptions of the symptoms of various types of damage to the brain have given and continue to give us information about how the areas of the brain interact and their various functions. Desjardins even proposed an algorithmic model of reading. Such a way of describing this type of cognitive model is still popular today. Desjardins died in 1917 after many exhausting years serving in an army hospital during World War I. Desjardins' wife, whom he married in 1888 after having her as a student, carried on much of his work after his death.